Whenever one is faced with a serious illness, and cancer is probably the best example of this, your world just kind of falls apart. And what was going along normally, wham, all of a sudden it changes on a dime. And it's a whole new world, a whole new language, the need for multiple physicians, one appointment after the other, not really certain about what the next day will hold. I think here at the Ruesch Center at Georgetown MedStar, I think one of our most important aspects of what we try to do is listen to that person. Where is that person today? What's in their heart and soul? How can we best help them today? What are their goals? And what this becomes is what we call patient-centered care.
I tell my patients I offer the multidisciplinary team. And in the multidisciplinary team, there's usually 4 or 5 subspecialty doctors. We work together, we meet regularly, at least once a week, to go over cases. So we communicate with each other about the diagnosis and treatment strategies. And from diagnosis to how to make patients' quality of life better, and how to obtain tissue for profiling, and how to control patients' symptoms with radiation. So it actually, the multidisciplinary team are constantly involved in the care of the patients.
Patients come in, honestly quite vulnerable with a new diagnosis. They're scared, not sure about what the future holds. And so my primary job is to make sure they're comfortable, make sure they feel that they're in the right place.
So at Georgetown, our model is cure personalis, care of the whole person. And we know that a patient is not just a patient, it's not just someone with a diagnosis, in this case cancer. It's really affecting their whole lives, and not just their lives, but their families' lives, their caregivers' lives.
I think it's very important to care the person as a whole and listen to the needs of the patient. At the same time, really try to explore effective treatments and innovative therapies for patients to improve patients' outcome.
We really want to work with patients to be able to not only help them in their journey through this arduous process, but to also help relieve some of their stress, some of their anxiety, help coordinate their care so that they don't have to worry about some of the more mundane aspects of the logistics of getting through the day with a diagnosis of cancer, through their blood work, through their treatments, through their visits in the clinic.
It's really tough to come in to meet with an oncologist with a new cancer diagnosis. And so I pride myself on really communicating well with patients and just taking as much time as needed with them. Never want them to feel rushed, because it's such an important conversation that we're having regarding their diagnosis.
I think being an oncologist is a hard job. And I think we do bond with our patients and provide care to them, and through the good days and difficult days.
And we do our best to take that information in from our patients and apply it to give the best advice tailored for that individual. That is our goal, patient-centered care.